A case for state and local integration of the separate federal radiological emergency preparedness program. An overview. The research question for this thesis was which benefits, shortfalls, and challenges emerge from the integration of the hazard-specific emergency preparedness and response program established under REPP with the all hazards core capabilities in the National Preparedness System doctrine. First, what is REPP? The Federal Radiological Emergency Preparedness Program was designed to address emergency preparedness and response protocols for potentially harmful effects of a radiological release from a fixed nuclear facility, otherwise known as a commercial nuclear power plant. There are two components to the program. The on-site component is concerned with site safety and defense in depth for accident prevention inside the fence by the operating utility. The offsite portion is concerned with accident preparedness, response, and recovery based on impact to populations and the environment in the community surrounding the site outside the fence. So why does REPP exist? REPP was created in 1980 after lessons learned from the 3 Mile Island nuclear power plant accident that occurred in Pennsylvania in 1979. It was intended to address gaps identified from the 3 Mile Island event to reinforce better on-site and off-site coordination for emergency preparedness and emergency response. It requires evaluated compliance with 16 planning standards as a condition of continued licensure and operation. What about today? When REPP was created, no other federal program or initiative was in place to provide an incident preparedness and response protocol for a catastrophic hazard. Today, most communities have implemented the National Incident Management System, or NIMS, and all hazards emergency preparedness and response, and many of the evolutions of emergency management within their communities. REPP continues to remain separate in a unique framework, creating the need for offsite communities with plants to maintain two distinct approaches. What can be done? REPP could be sustained in its current form. It could be replaced completely or augmented with a modernized framework. The results of the research show that augmentation may be the most favorable approach, which includes both a standardized oversight model and site-specific performance indicators. This approach ensures consistent requirements are applied to all fixed nuclear facilities, but that each locale can adjust performance indicators to meet specific needs. Radiation is special, or is it? Too much exposure to radiation is a factor for an increased risk of cancer. Power reactors are a significant potential source if a release occurs. Uranium as a nuclear fuel is used in both power reactors and nuclear weapons, although in much different levels of concentration. Throughout the Cold War and into today, nuclear weapons are a significant source of political power via mutually assured destruction. Accidents at the 3 Mile Island and Chernobyl power plants further galvanized public fear and provoked regulatory activism. It's worth taking a look at the science of radiation risk itself. The methodology used by the federal government emerges from studies performed during the nuclear weapons testing era. The basis of risk is calculated from the linear no-threshold dose model, also known as LNT, adopted to propose a direct relationship between exposure and potential health impacts. Some evidence now shows that the relationship between dose rates and human health impacts does not follow a strictly linear model. The scientific basis for current regulatory structure is still based upon hypotheses from an era when technology was limited from more discrete measurements and projections. The role of emergency management has also evolved. The field emerged from civil defense programs that were instituted to prepare the public for a potential nuclear attack. They progressed to address a wider variety of hazards via specific planning scenarios, and then all hazards frameworks later on. Attempts to bridge sources of assistance and broker resources throughout a fragmented and often siloed government structure was the goal. Regulatory responsibility for nuclear remains vested in the federal government, not in the states, and is sometimes seen as a unilateral imposition of risk to those communities. The research design incorporated three potential policy options for modernizing the REPP program. The first option was to integrate the current REPP planning standards with an emergency management all hazards framework. The second was to replace the REPP planning standards with the all hazards framework without specific capability requirements for the nuclear power plant hazard. The third option was to augment REPP with an oversight framework that includes site-specific performance indicators on top of a consistent basis for safety and risk criteria. The judging criteria for these different policy options included a number of factors. Number one was the risk assessment methodology, both historical and current. The public perception of risk, nuclear power versus nuclear weapons, industry support, trade-offs between efficiency and cost burden, the implementation effort, on-site and off-site, under specific resource constraints, and the federal regulatory implementation, both FEMA and the Nuclear Regulatory Commission, as well as the Price-Anderson Act. Each is a factor in evaluating the objective, output, outcome, and impact for four elements of risk-significant planning standards. The summary of the research framework gave consideration of the following towards the three policy options: trade-offs between efficiency and viability that can be measured, current sufficiency of the existing REPP program basis, an updated scientific understanding of radiation risk and nuclear safety. Utilization of four risk-significant planning standards as a common framework yields an effective basis for comparison. These include emergency classification, emergency notification, accident assessment, and protective actions. The research results show that a modern policy approach should incorporate existing REPP protocol with a robust means of measuring capability and performance for both on-site and off-site programs. The use of a consistent oversight framework to preserve the integrity of the common standards was a requirement. Measurable site-specific performance indicators were needed to meet individual site needs, and the application of a probabilistic risk assessment principle as an objective means in evaluation provided the final piece. The potential future benefits of this program would be to preserve principles but remove inefficient and cost-intensive structure of existing REPP for the off-site programs. This includes site-specific performance indicators that can absolve the need for direct federal agent observation as the only means of capability evaluation. It provides an oversight framework to replace the prescriptive nature of cost and time-intensive federal agent review imposed upon the states with the same model currently used for on-site program compliance. It also replaces the outdated and somewhat vague notion of reasonable assurance with actual measurable accountability. It introduces a system of metrics that are correlated with risk-significant planning standards to evaluate capability, and it discourages regulation by inspection and inconsistencies based on subjective evaluator observations as the only path to compliance. In the future, reform of REPP would allow for more cost-efficient operation of the existing nuclear fleet today, without waiting for the implementation of new technology. This would make on-site and off-site methodologies consistent, using a common oversight framework with performance indicators to reduce overall program cost. Some aspects of the off-site evaluations could be delegated to state and local governments, as the Nuclear Regulatory Commission does with its on-site program. This would be in order to reduce burden on Federal Emergency Management Agency staffing. This would also allow programs to define site-specific performance indicators that capture the unique aspect of these programs without seeking an overall prescriptive-focused, one-size-fits-none framework for all sites and programs.